We return to Sheba and Moorfields to learn a little bit more about how responding to the COVID crisis created a culture of innovation. So how are these two case studies innovating health services using digital technology?
In both the Sheba and Moorfield cases, you could say that digital technology here is transforming the way in which frontline interactions occur between the service provider and the service user. And as a result, that is also changing the service provision of both organizations. And that's part of where the innovation is at as well.
It's interesting in both cases where you see how the COVID crisis challenges the norms of perceived technology use, established ways and norms of what kinds of care could be provided at a distance or needed to be face-to-face were out of necessity challenged. And that led to the opportunity and strategic improvisation of care in many different new configurations coming to the fore, not only to address what was needed in the continuity of existing care, but also in the case of both hospitals to rapidly innovate within other areas.
We see emergence of new models of care, hybrid models, where you have the physical environment with virtual environments and the combination of them. So just to give you an example, Sheba has just opened Sheba Beyond, which is a virtual hospital where the physical units in the hospital are actually in charge of also home hospitalization of patients at home. So they are managing physical beds in the unit and virtual beds at home. And this requires really a system, a digital twin to operate the hybrid operation of the physical with the virtual. And I think there is a lot of potential in developing this concept.
Does digital inequality make these services less accessible to some people?
For obviously having to rely on mobile phones or a webcam and a computer, etc. And still the traditional questions when it comes to this type of technology are raised as to do they have access to equipment and do they have the technical ability?
Start to see during COVID more engagement and use of the patients who had the smartphones in this actual diagnosis collaboration, if you like, with the service provider. The role of digital technologies that in exacerbating potentially digital inequalities is something that needs to be looked at from a policy perspective, both at the hospital level, but also more generally from a government Department of Health perspective.
Also, the level of technology is an interesting point. So I might have a very good smartphone with a clear speaker and microphone and with a good camera, but somebody else may have access to a lower level of technology. And so they have a different experience, and that is somewhat out of the control of the hospital because we are relying therefore on the user's ability to connect with the telemedicine situation.
Digital systems are becoming increasingly interconnected, and digital twins are a first step to providing remote medical services. We see that these digital twins can be connected to provide ever greater levels of integration. How does this impact the service pathways for users?
Well, I think what's interesting there is understanding how nested many of these questions and technologies and systems and people are. So if we're thinking of the smart hospital in terms of a digital twin of the building and understanding how that interacts, we also need to understand how the hospital fits into its surroundings, the digital twin of the area around the hospital. And then, of course, that area is embedded in larger transport links where people are coming from across the city. And so understanding a digital twin of the city and how that impacts potentially the delivery ultimately of that care pathway. And at the same time, understanding how patients and staff have to fit into those digital twins to ultimately either deliver the service or receive the service.
That interconnection between how different types of digital technologies whether it's telemedicine, AI, digital twins, all work together in helping clinicians along with patients and a wider set of ecosystem partners to really rethink and redesign the service and perform service innovation. Is very connected as well into how we think about the design of the built environment of the future, therefore the smart hospital of the future, and how it will be very much looking at reconfiguring care through technologies and new service pathways for patient experience as well as better service outcomes for service providers.
Interesting to realize that even when we're talking about remote healthcare by digital technologies, still the built environment, the place where it takes place, really has an impact on the implementation of the technologies. So, for example, we looked at emergency hospital and intensive care unit that was employed in an open space. In comparison to internal medicine unit, it was employed in a typical unit with semi-private patient rooms. And the layout of the space really had an impact on how they use the same digital technologies. And one of the things that we realized is that they had a real challenge with spatial perception. So just imagine that they were looking at a lot of screens with video cameras on each patient and in each room, and they had to conceptualize the layout to understand where the patients are located, where are the staff working, and where is the equipment, and it's all dynamic. So a digital twin that will integrate the communication system with the audio-visual technologies, hopefully with the medical record as well, showing also the spatial location, would really enhance their ability to operate the unit and to enhance the safety and the quality of care.
The way in which a digital twin might be useful in the future, maybe to, especially in situations where the nature of the service is time critical, really offer that, address those challenges of being able to have spatial perception managed better. And indeed, this would really take the digital twin technology and its application to a new level.
It's a very exciting period to witness the transformations in healthcare. And digital twin as a concept can really promote the design of the new system, the design process of the built environment and the technologies, but also really help operate. As we discussed before, the hybrid models looking at the physical and virtual environments together.
The people who need to drive the change need to be ones that are actually providing the service. We're now in a new era where post-COVID, where we have seen a widening gap really between those organizations that have been able to build up the capabilities and infrastructure beforehand, and the foresight to start to encourage and enroll different players, both in their organization and ecosystem, to drive change. And it is now a very good tipping point for that enrollment, that establishment of the appropriate and indeed sensitively delivered ways in which to think of the redesign of services in building the new built environments of the future, where we have a wonderful opportunity, recognizing the challenges, but recognizing what we have learned from the crisis.